morning, everyone. I'm Francis Collins, the Director of the National Institutes of Health. It's my privilege and pleasure to welcome you to a very special moment in the life of this remarkable institution, NIH. You have already noticed a guest of honor who will be introduced in a few moments by Dr. Fauci. I do want to recognize the people who are standing behind me who have been part of the medical team that has cared for Nina Pham. Among them, really distinguished, remarkably dedicated nurses, social workers, and physicians. Among the physicians, we have Dr. Rick Davey, Dr. Cliff Lane, Dr. Tara Palmore, and who am I leaving out? I guess I've got you. Dr. John Gallen, the director of the NIH Clinical Center, all of whom have been involved directly in the care of this patient. We think of the National Institutes of Health as also the National Institutes of Hope. And I think hope just went up a notch today by the fact that we are all here to celebrate the recovery of a patient who clearly was afflicted by a disease that is very serious, and yet under the careful care of this remarkable staff is now here before you. I'll now like to call on Dr. Tony Fauci to come and tell you more about why we're all here. Dr. Fauci.
Thank you very much, Francis. As you are probably anticipating, I have some very good and happy news to impart on you right now. Our patient, Nina Pham, is free of Ebola virus. We know that because we have multiple determinations of her PCR. She has no virus in her. She feels well. As you will see in a moment, and probably have already seen, she looks extraordinarily well. I want to first tell you what a great pleasure and in many respects a privilege it has been for me and the staff here of the Clinical Studies Unit, the Special Clinical Studies Unit here at NIH, to have the opportunity to treat and care for and get to know such an extraordinarily courageous and lovely person. She, as an individual, is extraordinary, but she also represents the nurses and healthcare workers who put themselves on the line and put themselves in a risk to take care of people who are in such need. So I'm going to introduce and bring her here, but before I do, I want to have a shout out to a few people and individuals. First, thank you very much to the doctors and nurses of Texas Presbyterian who took such good care of her before they sent her to us. I also want to have a recognition for the extraordinary staff of doctors and nurses here in our own Clinical Studies Unit who did an extraordinary job in taking care of Nina. And Nina is very sensitive about the role of nurses because she's such a devoted nurse. So, as a tribute to her, I'm wearing the colors of her nursing school, Texas Christian. So we should have a shout out for Texas Christian for training such an extraordinary individual. So what we will do is I will have Nina come out. She will read a statement. She will not answer any questions. After that, I will come and answer a few questions for you, and then we'll get Nina to go back home to Texas to resume a normal, healthy, and happy life. Nina?
Good afternoon. I feel fortunate and blessed to be standing here today. I would first and foremost like to thank God, my family, and friends. Throughout this ordeal, I have put my trust in God and my medical team. I am on my way back to recovery, even as I reflect on how many others have not been so fortunate. Of course, I am so incredibly thankful for everyone involved in my care from the moment I became ill and was admitted to Texas Health Presbyterian Hospital, Dallas, up to today, my discharge from the Clinical Research Center of NIH. I would especially like to thank Dr. Kent Brantley for his selfless act of donating plasma to me. As a nurse, I have a special appreciation for the care I've received from so many people. Not just doctors and nurses, but the entire support team. I believe in the power of prayer because I know so many people all over the world have been praying for me. I do not know how I can ever thank you everyone enough for their prayers and their expressions of concern, hope, and love. I join you in prayer now for the recovery of others, including my colleague and friend Amber Vinson and Dr. Craig Spencer. I hope that people understand that this illness and this whole experience has been very stressful and challenging for me and for my family. Although I no longer have Ebola, I know that it may be a while before I have my strength back. So with gratitude and respect for everyone's concern, I ask for my privacy and for my family's privacy to be respected as I return to Texas and try to get back to a normal life and reunite with my dog Bentley. Thank you, everyone.
Thank you very much, Nina. Before I open up for questions, I want to recognize two people who really helped us in linking with Nina and getting to know her as essentially a member of our family here at NIH. And that is Nina's mother, Diana, and her sister, Kathy. Okay, so questions?
Dr. Fauci, how do you know that she is virus-free? What did you do for her while she was here at NIH?
Well, we know she's virus-free because we now have 5 consecutive negative PCRs on her. Now, I don't want anyone to take from that that is the norm and the standard, that you can only guarantee someone's virus-free if you do 5. We did 5 because this is a research institution, but that's not the norm. We provided her with supportive care, and that's something that I've been saying all along, that one of the most important things in bringing back an Ebola patient to health is to give them the kind of medical general support to allow their own body to then be able to fight off the virus and essentially get rid of the virus. I would leave that up to her, but that's not for me to answer right now.
Dr. Fauci, a more broad question, given all the concerns that exist right now with what's happened with the doctor in New York City right now, should Americans or others returning from the Ebola zone be forced into a more strict or mandatory quarantine?
That is something that is right now under very active discussion, and you'll be hearing shortly about what the guidelines will be. But I want to point out to remember that it isn't just the CDC and the federal government, but the states have an awful lot to say about what happens when people come in. But you'll be hearing more about that.
Give us the sense, you're an expert right now, but your take though right now, because there is real concern in New York that if you went to a bowling alley or sit on a subway car, that you might be in trouble. So is that an unreasonable concern?
Well, I think I can repeat what we've been saying all the time, that the way you get Ebola is by direct contact with the body fluids of an ill individual. And if you don't have that, you do not have to worry about Ebola. And I think that's important to point out, that you must separate the issue of the risk to a general public with the risk with brave people like Nina and her colleagues. They're two different things. Nina put herself in a situation where she knew it was a risk, but because of her character and her bravery and that of her colleagues in the field, she happened to unfortunately get infected. That's a different story from the general public. She was with a very sick person.
Dr. Fauci, what have you learned by treating Nina Pham? What have you learned, and what experimental drugs, if any, did you use, and what can you teach other doctors such as Dr. Spencer in helping him recover?
Well, first of all, we did not administer to Nina any experimental drugs while she was here under our care. We followed her. We have a considerable amount of laboratory data. Remember, this is only one patient. We are in contact and discussion with our colleagues at Emory and at Nebraska. We continually compare notes back and forth. And I think it's important for people to understand that there's the public health issue and there's the scientific issue of understanding what's going on. And that's essentially what we do here. Primarily, it's the care of the patient first. but together with that is to learn information that might help others. Now, that's easy to do when you have a whole bunch of people that you could collect data on. But when you have one or two or three, you've got to focus very much and try to get enough information where gradually we'll be able to say things that will help others who are taking care of patients. That's the reason why we may have done different kinds of lab tests or more of them. That doesn't mean that everybody has to do that, but we're trying to learn from that.
Why has it taken so long to get an Ebola vaccine? There are reports today that there was one ready for human testing a decade ago.
Well, there's a lot of reasons why when you say to get a vaccine, you got to make sure you separate that from a vaccine candidate. Because if you're saying a vaccine is something you could distribute, first of all, since Ebola is a disease that has outbreaks and then disappears, it's very difficult to be able to prove something except in the setting of disease, which we're actually trying very hard to do right now when we go from a phase 1 study, when we show it's safe and that it induces a response that you could predict would be protective. We're planning a larger efficacy trial that's a randomized controlled trial to be able to do that as well as some other designs. Now, in direct answer to your question, you might recall that we started on this 10 years ago, and we've done different iterations of improvements. One must appreciate that the incentive for a pharmaceutical company to get involved in putting a major investment to develop a vaccine for a disease that up until this outbreak had less than 2,500 people infected. We did not have the kind of incentivization on the part of industry. We certainly have that now. So it was not essentially a scientific obstacle, and it was not an obstacle of wanting to have one. It was the ability to actually bring all the cards together to get that.
The ability to get funding for it.
No, I don't, well, first of all, the funding one is a very complicated issue. I think we should put that off the table because we're really talking about what we're doing right now. And we're on the way in the sense of we have the capability and the resources to do the trial that hopefully will start in the beginning of 2015. Yes.
Can you pinpoint a turning point in Nurse Pham's care where you just saw things turning around, saw the tide turning in your favor?
Well, you know, I don't want to make an absolute statement on that because remember, she was taken care of by very good people in 2 separate hospitals. So when she was in Texas Presbyterian, she was in the process of actually doing better. She came to us and she continued to do better and better. We both supported her, so I can't pinpoint in one patient what was the turning point. The only thing that we're really happy about that the turning point occurred.
Was the plasma donation from Dr. Bradley, was that?
That is conceivable, but you can't prove that. The question you may not have heard is, was it the plasma transfusion from Dr. Kent Bradley? Certainly that could be the case, but remember, when you have so many separate factors at the same time going into the care of a patient, and the N is 1 for this patient, it's virtually impossible to say that this is the thing that did it and this is the thing that didn't do it. It's just impossible to do. I'm not trying to evade it. That's the reason why you want to do clinical studies where you can actually get that information so that the next time we have an outbreak, or maybe even during this outbreak, we can say this is the recommendation because we know it works. At this point, everything is experimental, and that's what we're trying to do, is take the experimental and make it evidence.
Dr. Fauci, first of all, Nina, since we haven't said it, we're so happy that you're well, and congratulations. We wish you well as you go home today. I want to ask specific about, Nina, the experience. The WHO reports that about 70% of those with Ebola in West Africa die because of this virus. What explains the speedy recovery of someone like Nina Pham and Amber Vinson, the other nurse?
You know, again, I wish I could give you the answer to that question, but we don't know. But I can tell you the things as a physician, what goes into a patient getting better. It's anything from she's young and very healthy, number 1. Number 2, she got into a healthcare system that was able to give her intensive care early. Number 2, she was then transferred to another healthcare system which was able to give her everything that she needed. That's one of the reasons that almost common sense tells you that that contributed. How can you relate that to 70% versus this percent? It's impossible.
Dr. Fauci, what is Nina's prognosis? 100%? She's cured? Any long-lasting effects?
Well, first of all, when she is cured of Ebola, let's get that clear, okay? That's for sure. Now, long-lasting effects, when you have, I'll give you an example. A few years ago, I had bad influenza. And influenza is trivial compared to Ebola. And even though I got back up and went to work, I was feeling tired and worn down. So I wouldn't be surprised if over a period of time, anyone who has had the experience of recovering from Ebola will take time to get their full strength back. She will. Whether she gets it back next week or 2 weeks, I don't know. That's her. And she's such an incredible lady. She's going to do it quickly.
Along those lines, Dr. Fauci, are there any restrictions right now on Nina's travel, where she can go, who she can talk to, who she can see, and how does she travel back to Dallas? Will this be a private charter, or will she fly commercial?
I would have to leave that confidential right now because that's something personal and private, because I don't want to have hordes on her. We're trying to, as she asked for her privacy, we'll give her privacy.
Dr.
Yes.
Fauci, can you talk a little bit about the communication with Nina's family throughout this process? Was she allowed to talk to them, and how closely did you relate information about her condition to them as this was unfolding?
She had, we have a system in there that's easy to communicate. You know, the family talks by phone, by FaceTime, and things like that. So when I'm not going in the room, I'm just coming by to say hello, she taught me how to use FaceTime. Anything else? One more, and then we have to get her off and home.
As a public health professional, how confident are you that hospitals are getting the proper information and going through the proper procedures so that other healthcare professionals like Nina won't end up in the same situation as we see more Ebola patients entering hospitals, caring for them, and being exposed themselves?
But as you probably have noticed, there is a very strong, aggressive educational effort going on that is led by the federal government, the CDC playing a major role in that. We're doing telecoms, we're doing a variety of things that are trying to educate more people, not only educate them, but also make sure we have people trained, retrained, practiced, people who have the capability of recognizing, identifying, and isolating. All of that is really getting scaled up. Thank you all very much. We appreciate you being here.
Dr. Fauci, how much are you going to miss Nina?
I'm gonna miss Nina a lot. I gave her my cell phone number just in case I get lonely.